Hello, people. Welcome to another Dragon Firesides. I have a very special guest today, Dr. Rosanna de la Cruz. She has been a longtime client now and is one of my favorite people. So, Rosanna, one of the things that I always do is I have people introduce themselves. I don't want to be the guy that forgets the thing. And I'm sure, you have a better story than I do of you. That makes sense.
We have a lot of stories for a couple of years. I think you know a lot already. Well, thank you for having me, David. And yes, my name is Dr. Rosanna de la Cruz, and I am a Chinese medicine doctor, a functional medicine practitioner, and I specialize in reproductive health, helping women live their lives full of vitality and joy and empowerment. So
All right.
that's what I work for.
That's very short. You also own 3 clinics, including your
Yes.
newest one for women's health specifically.
Yes, we have 3 clinics, 2 in New York City and one about 10 minutes away from New York City in a neighboring town. That's our newest practice, and it's an amazing experience to see all the women coming in. And the name of the practice is Women's Holistic Center. We chose that clinic because 95% of our patients in the other 2 clinics are women. And so we want to create a space for women to come and know that it's all about them.
Yeah, very good. I remember a story that you told me about, I believe you worked with a very famous practitioner, acupuncture. I'm reaching for it and I can't find the words. Um, I want to say understudy, but that's something you do in theater, not, not in clinic.
Yes, I mean, I have worked with several practitioners. I had a mentor also. It's been great to really take a deeper dive into women's health. And I'm very grateful to Chris Axelrad. I took a certification of reproductive health with him. An amazing, brilliant practitioner. He really has been a great mentor for me and a very powerful force behind women's health. So I've learned a lot from him and all the courses that I've taken as well. But I would say that's how my journey started into women's health and functional medicine, combined with Chinese medicine.
Very cool.
Yes.
All right. Thank you for that introduction. So, this is becoming a very big conversation right now. The guy that does, what's his name? Not doctor, the guy that does, Diary of a CEO. He just had a panel in October of last year where they were talking about women's health and I think perimenopause specifically. Um, and this is something that historically we haven't done very well when it comes to women's health, right? There's always guys in white lab coats telling women how they should be feeling and what's real and what's not. And finally,
Yes.
we have a voice, we have platforms, and so that's sort of what I wanted to get into a little bit today. Is for you to give me like the reason that you've ended up focusing on. Is it just a function of who was coming to see you, or is there something that is connected to your personal life or your mission in some kind of a way that made this be like your focus?
It's definitely a calling. And also, I'm going through perimenopause myself. And I can say that this is the best time of my life. In Chinese medicine, we call it the second spring, all the way through postmenopause. And it's also in addition to the thousands of women I have helped, along with the practitioners who work in my clinics. It's just a need because there is not much behind it. There is a lot of more information, still a lot of information that sometimes contradicts itself, and it's hard to kind of find a line that you can follow. And I know by combining different modalities, including the functional medicine, the Chinese medicine, which is an amazing practice, and I'm honored to be a practitioner of Chinese medicine, along with the herbal medicine and functional nutrition testings, just to go beyond what regular labs are telling us. It's just the time. And for me, it's more of a calling because of the transformation that I've gone through. I feel better than I felt in my early 20s. And it should be the opposite based on what we are hearing everywhere. And that's because I
Right.
have been able to implement all of the self-care and also supplements, testing, asking questions, and also guiding my patients also to do the same. And not only my patients, but when another practitioner in my clinic takes care of patients, I'm completely involved in their care and their treatment plan and how they go from A to Z. And one of those things is seeing them recover their health, wanting to go on vacation, wanting to do more, going back to hobbies they forgot they liked, and also having more energy. And for me, that is my passion, that is my calling. And I found it through practice, because when our calling can change throughout our lives. When I was early in my career, it was about helping as many people. But then when I saw the foundation of women's health is so disconnected from the body, from the mind, from every part of what health means, because we look at the physical health and we are saying, oh, okay, I feel healthy, all my labs are great, I don't have any disease. But health is comprised of several things. We have social health, we have physical health, emotional health, spiritual health, mental health, financial health, sexual health. So when we look at this whole combination of health and we feel like we're thriving, we own our health and we are empowered, not waiting for someone to tell us, look, you are going to be having this condition for the rest of your life. Here is the medication. There is no other way. With not enough resources, of course, the doctor is doing their best. That's all they know. But there are other options. And this is how I fell in love with women's health, and specifically now perimenopause, which we're talking about, and helping women really live their best stage of their lives. Because the truth is that we all go through it. We're not going to avoid this phase, but we can thrive. And we are now at the best time because there's so many resources available. If we go back 100 years ago, women didn't make it. We talk about the sages, but a sage woman was probably 50 or 45 because there was no hair color available, no very little makeup, sun exposure, no SPF. So a woman who looked 80 and they're 45 could have been a sage. Yet today, women at 50 look their best. They're working out, they thrive in business, they are no longer, some women are still having smaller children in their house. Others are just looking for other destiny, starting a new life, enjoying more. But if we don't have a map to know how to enjoy this phase, then it becomes very confusing. And sometimes we can question ourselves to see, is it me? Am I going crazy? I mean, everything is fine, but I don't feel fine. So I see it every day in clinic, not only on the patients I take care of, but the patients who are being taken care of by the practitioners who work in my clinics as well. And it's just an amazing transformation to see once they are empowered and they can go back to live their lives fully.
Yeah. Yeah. So, what do you think is one of the biggest misconceptions that Western medicine specifically gets wrong when it comes to women's health and maybe even perimenopause specifically?
Yes. The biggest misconception I've seen is that there is no need to test hormones. So yesterday I had a patient who told me, I asked my gynecologist for hormone test to see if I could be, if the reason for my pain, the hip pain, she has hip pain, she has anemia, heavy bleeding, she has inability to fall asleep, she is groggy. Her ferritin level, by the way, she had taken some blood tests and her doctor said everything is okay. The minimum on the scale for that doctor on a ferritin level was 16. The maximum is 232. Her ferritin levels were 5. And she was sent home saying that she was okay when she doesn't feel like herself. It's like she lost herself because she doesn't have enough reserves. And when she told her that she wanted to test some of her hormones, I would like to test some of my hormones. The physician said, nobody has died from perimenopause or menopause, meaning that they were not going to do the labs. When we look at labs, we look at it differently. An example of this is estrogen. There are several types of estrogen. So sometimes they only test one. Several types of androgens, meaning, the testosterone and DHEA, different type of hormones that we look. We look at the blood panel a little different than just looking at the scale and looking that it's on the green or supposedly normal. We look at nutrient deficiencies. And so these are misconceptions. Even if your practitioner doesn't want to test, I will push or get another practitioner who can test specifically for your hormones so you can prevent disorders such as metabolic syndrome disorders, such as cholesterol levels being unmanaged, insulin resistance that can lead to diabetes and hypertension. Those are not considered menopausal conditions or perimenopausal conditions, but they can lead to death. In fact, women's cardiovascular disorders are a higher risk once we start dwindling in our estrogen levels and progesterone and testosterone. So we're not, the doctors say, oh, well, nobody's dying from menopause, but people are dying if they're not having a good hormonal balance that can help them keep their metabolic health as they could nowadays. So that's the biggest misconception, saying that we don't have to test. We don't even have to treat. It's supposed to be like that. You're supposed to have pain and not sleep and urinating every 5 minutes because of lack of estrogen. No, we're not. We're not supposed to feel that way. There are options, and this is why I work.
Yeah. So when you're treating somebody, do you what how much of it is like therapy? How much of it is lifestyle, or is it too hard to make some kind of generality when it comes to like the boxes that women tend to fall into in terms of the things that are exacerbated in the form of perimenopause?
I would say that we cannot do one or the other. There has to be a combined a combined modality. In our clinics, we do acupuncture. We have a lot of telehealth patients who we have helped, and they don't get acupuncture. Acupuncture is great and is another great modality we employ to help women achieve their health. But that doesn't mean that it's the only way. So we use a combination of therapies that is necessary. So most 90 to 95% of our patients come once a week for acupuncture treatment for a set amount of time based on each individual condition. And then from there, we give them a treatment plan. And this is what they do every day. How they lead their lives, how nutritional supplements along with guides. Every so often we reassess what their goals are and then refocus on things that have emerged, or we can file away those goals and know that they have achieved those goals and we can move forward. So the combination of therapies of herbal medicine, functional medicine, Chinese medicine, and the lifestyle changes along with the dietary changes is a must. We cannot only employ one modality because it's just not enough. Just like being only healthy physically is not enough. If we don't want to go outside, that's could also be part of our mental health or our emotional health or even lack of energy. It could be a combination of things. So we should treat it as a combination of therapies as well.
And do you think that there's a place for allopathic medicine inside of what you do if they're paired together, or do you think that like
Yes,
okay,
I do. I think integrating both is very important. We know that bioidentical hormones, including HRT, of course, there's got to be a lot of testings before because not every woman qualifies for hormone replacement therapies. And there are also some natural compounds we use in traditional Chinese medicine and also some supplementation that include herbal and adaptogenic herbs and some other supplementations, just minerals and vitamins. For example, like vitamin D3 is a vitamin, but it's also a hormone and it participates in every system in our body. So when we look at allopathic medicine, we definitely need the support. And unfortunately, in this country, in most countries, allopathic medicine is still at 1.0 instead of 2.0. And so we can get what we can get. And this is hopefully a practitioner who's open to test to see if you can qualify before it's too late for HRT. And as well as sometimes there's medication we need. And making sure that we are supporting preventing things like frequent urination or frequent UTIs. There is pelvic physical therapy that women can get, which is amazing. So there's a lot integrative care that can help. And whatever helps, this is what I tell all my patients, like whatever helps. Someone who has high cholesterol levels, we should definitely make sure that these people are being taken care of medication until they no longer need it. So that integrative care can really help our patients just go back to living their lives fully charged.
Mm. Yeah. So my typical audience that watches the podcast are other practitioners. So, I'm sure that a lot of them, have a similar treating history to you, have some background in studying this kind of stuff. But with this podcast, one of the things that I was hoping to do is to kind of put it out there in a way that just a woman off the street could listen to it and get some value out of it. And I'm assuming, and you correct me if I'm wrong, but I'm assuming that women don't even necessarily understand their health in a way that they know what to pay attention to. So in terms of this symptomatically, what do you put under the umbrella of this phase of life for women? What should they be noticing, or how should they, kind of, yeah, take a step back and look at, the prognosis of their overall condition, and what are they accepting as normal that isn't?
And we should not accept any. At first, I'm a little bit of a rebel. That's why I went into Chinese medicine. I have about 10 physicians in my family, including my parents. So Chinese medicine, I don't know anybody Chinese in my family. I am from Dominican Republic, so not that many Chinese people. I never met a Chinese person there. But I know in the Dominican Republic, they say, look, when somebody is so sick, they like, not even the Chinese medical doctor can save that person, meaning that they beyond care from anyone. If the Chinese medicine doctor cannot care for them, then they cannot be helped. So as far as what normal means, we cannot. This is part of what the lab test is, right? Or you're normal. No, who determines what normal is? You used to be a person who used to work out or not, but you used to love to go for a walk or play with your children or spend time with the people you love and be fully present, be social. You used to be working and come home and feel great. Anything that changes in your life that you're not okay with, that's not normal. So no one gets to tell you what normal is except for yourself. And of course, we can look at the labs, but we also have to look at the way your activities of daily living. That's extremely important. And also, something that starts creeping up is abdominal gain weight. And a lot of women go on hormone replacement therapies and they start gaining more weight because sometimes there is a type of estrogen that accumulates and we turn to become estrogen dominance. So the patches of estrogen are not helping you. And so when we look, and these are for women who are on hormone replacement therapy. So we look at different things like, are you absorbing, are those hormones that you have are available for your body to use? And we can find out. And most of the doctors don't test for this, but we do. And so in this case, we look at what normal is based on what you want, your goals, how you want to live your life. And then we can look at and see what's broken. Not every woman is gaining abdominal weight, but a lot of women are fatigued. They don't want to have sex with their partner, or they don't have motivation to do anything. They feel like they're losing themselves. And then they hear everybody else saying, oh, that's just a part of aging. I had another patient yesterday who told me that she's 55 and it's all downhill from now. I'm like, no, there's no downhill. I'm 50 and in 5 years, I'm going to be better. This is your second spring. So let's go. So it's about what we hear, but also it's about what we settle for. So my ask is do not settle for what other people say that is normal for you. You get to know what and choose what normal is for you. So start to look at how your body is working. Are you having lack of energy and being fatigued? Do you have digestive issues that are crippling up? Feeling swollen, joint pain, some weight that is not associated with changes of eating, or maybe changes of eating because now we're more anxious or not sleeping. Progesterone is one of those hormones that cause restlessness at night. So if we are not sleeping at night, we think we're overthinking, and it's just that we don't have enough progesterone. And so we look at things like that and determine what normal is for you. Other women sleep great during the night, and maybe they have high cortisol levels, so they are tired in the morning instead of even when they sleep a lot or enough. So we have to look at every individual case and know that we get to determine what normal is. We don't get to be told what normal is. That's how I live my life. I get to know what normal is for me, and then I design my life based on that.
I like that. So it's like you look at it like like we look at, I do marketing, right? So I'm always looking at campaigns and how we optimize them. It's never, it's a function of knowing what lever to pull in what order at what time. And it seems like there's something relevant in the way that you approach, the health picture of a person inside of that. Um, Now,
Yes.
I wanted to get a little bit more like insular though. So like what I'm imagining is a person that just doesn't feel like themselves, but they don't know exactly why or what is different. And so I'm just gonna say some things that I think could be a part of the picture. I don't have a background in women's health. So I may sound, silly or uninformed when it comes to this, but I'm assuming mood changes, sleep
Mhm.
changes, cycle changes, energy changes, sex drive changes, maybe thickness or shine of your hair is a thing. Maybe complexion is a thing. I don't know if I already said weight gain.
Mhm.
What am I missing anything? Uh, uh, are those
No,
kind of the
those are
main?
Those are, but one that is very common and is not spoken about is a weird head kind of lack of balance sensation that acts as an aura. And I would say 90% of the patients who I treat in perimenopause have this. It's almost like they're walking, and the same like walking can lead to like almost like a little weird aura. And it can be considered migraine in neurology, but it's not a headache. It's more like this heavy sensation, almost like you cannot adapt to your environment. And it doesn't come with hot flashes all the time, but it could feel like a rush of weird energy. And that we call a vagus nerve dysregulation. So you can feel a little weak after it passes. It's not a hot flash per se. You don't feel hot. You could, but that's a major one that has I have been seeing in clinic a lot. And it behaves like an aura. So after it passes, the patient feels kind of weak. And then that's a question, what is wrong with me? Am I dying? Like another one that is very common, especially for women who are burnt out or have been pushing for a long time with high expectations from work or a lot of family expectation, women who have a lot on their plate, is palpitation during rest. And this is a scary one for many women because they can be asleep in the middle of the night and they wake up with this rush, and their heart rate can be at 120 with no triggers. So a lot of women go to the ER and it's like, everything is fine. Let's give you some anxiety medication." When in fact, it's a high cortisol level because we are constantly on high alert, and it's almost like we're waiting for the next crisis. So we have to respond because our plate is so full, and we get into an adrenal response that is just exhausted or too much. And then we get all those symptoms of palpitations during rest. And we treat this so beautifully with functional medicine, herbal medicine, and Chinese medicine. And it is one of the easiest things to treat, but it's one of the most scary ones, those two. That aura that feels like you kind of gonna faint and you don't know what's happening, and those palpitations at rest that you feel like you're gonna have kind of like something is wrong with your heart, which that's all a hormonal response. And the thinning of the hair is what I was talking to you about this earlier with this patient who had the ferritin levels. That's a marker for hair loss because we've been bleeding all this time during our period. Sometimes it changes to be more heavy bleeding, extended bleeding. So we're losing all this iron. Our reserves of ferritin go down, and then we lose hair because the follicle cannot regenerate hair. And basically, we just, that follicle that holds the hair doesn't get enough blood circulation. Therefore, we get thinning of the hair, hair loss, and all kinds of crazies. Hair is very important, and skin too. All of
Yeah.
those are affected by the blood circulation. So if we don't have enough blood, as we know in Chinese medicine, everything gets affected.
Right. Right. Okay. Um, I don't know if this is worth getting into. It was something a vet said on our call before that
Hmm.
my wife is a person of color. You're a person of color, and we're famous in this country for not having a healthy history of any kind when it comes to the way that we treat people of color. But
Yes.
specifically in medical communities, there is this idea that a person of color, for whatever reason, is not treated the same in medical spaces as white people. That when they're complaining about things, it's not taken as seriously. That when it comes to the urgency to solve problems, it's not given as much space. Is that something that you think is changing, or is that something that you still think is a real thing?
If we look at the history of gynecology,
Yeah.
there used to be dissection in women of color with no anesthesia. So that is the root of gynecology. And I don't think it has changed because I'll share my experience, which is very personal to me. But because I'm going through perimenopause, I'm being very proactive about whether I am going to do HRT in the future or not. And I have a great gynecologist, by the way, which I recommend my patients to go to her because she's very open. However, that rooted cause of gynecology, which believes that some people don't experience as much pain, is still there. She recommended that I get a biopsy just to see if there is any risk or any reason why I wouldn't in the future qualify for HRT. An endometrial biopsy is when they remove tissue from your womb so they can study it and see if there are any potential contraindication for HRT in this case, but there are other things that can be diagnosed. The only reason why she asked me to do this is to see if in the future I decide to be, then she can just prescribe it for me. She's kind of ruling out things, which is great. I don't need hormones right now, but I don't know, maybe I will need it, and I'm open to it. And so I went thinking, oh, I'm just going to go to my biopsy. Then I go back to work. Like, I'm just going to go back to this clinic to, support one of the practitioner. The appointment was at 2:00. I went, she read my thing, and I'm like, yeah, let's do it. There is no anesthesia for biopsy. I mean, it's actually worse than having a colonoscopy with no anesthesia because they go into the womb where is so much nerve endings. I did not know this. I hadn't eaten lunch because it was rushed and I was supposed to eat lunch before. And long story short, I didn't eat lunch that day. So I was starving. And then she went cold turkey to remove. When I saw the little cup, I passed out on the table of the pain. And then I couldn't take ibuprofen immediately because I hadn't eaten. So I had to get home. And for a whole week, my pelvic region was in pain. I recovered. I did acupuncture. I took anti-inflammatories. But this is a procedure that is done every single day, outpatient and inpatient. I didn't know what I never had a biopsy. So I'm like, oh, okay, yeah, sure. Like, whatever, let's do it. I
Yeah.
did not go back to the clinic to work. Like I was out. I'm like, oh my God, I need something to eat first. And then I need to lay down and get some painkillers.
Yeah.
How can we be doing biopsy, removing pieces of tissues from the womb with no anesthesia? And so, yes, that has not changed. Specifically for women of color, I cannot tell you the amount of times women with endometriosis, fibroids, which by the way affects women of color more than others because of exposure to all the things that we don't kind of want to get into now. But hair relaxers are one of them. And nobody told us, all the hormone disruptors in our cosmetics and our products that we use, um, socioeconomic factors too, indoctrination from our cultural background, all of that affects our women's health. And so they are not treated the same because I treat those patients in my clinic and they do things like that, that
Yeah.
you just take little pieces of womb without anesthesia, and it's supposed to be normal. Everyone I spoke with about it's like, yeah, I had that. It was horrible, worse than giving birth. to my
Yeah.
child. I'm like, yeah, that should not be done, you know?
No. That's
So
yeah,
yes,
I
it's
think
still there.
that's you should have informed consent when it comes to things like that, and that's not that. That you just actually reminded me when my wife was pregnant, she had 10 fibroids, and one of
Wow.
them was about the size of a golf ball, and it went into necrosis, and she was having so much pain that she couldn't walk. So I was actually
Yes.
treating her at the time. Nope, we got sirens. Let's give us a second. Okay.
Yes.
Um, this,
Sorry. It's
it was,
horrible.
it is
I don't
relevant,
hear
but
them.
it wasn't. Yeah,
I don't even hear them anymore.
yeah. She was in such pain that she couldn't walk, and I was treating her just to give her enough of a take the edge off of the pain so that she could walk. And when we went to the doctors, they said that, oh, it's probably just gas. It's probably
Oh
just
my
gas.
God.
And we had a midwife too. So it was our midwife that was like, this is not sitting well with me. Like there's no way that gas could cause the level of pain that she's having. And so she gave the scans to another doctor, and that doctor said, no, 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 these are fibroids. So yeah, just the dismissiveness. It's like
Yes.
two doctors reading the same scan, and one doesn't see anything and the other one does. And
Yes.
it's just kind of the way that it's just sort of dismissed and not worth full attention on a thing that felt like maybe this isn't just, maybe there's something rooted deeper in the psyche of the person that has to do with what my wife looks like. So I don't know that, and we try not to live our lives in a way where we're looking for
No.
villains or anything like that, but that really was kind of the feeling of having that
Yes.
experience. So
And let me tell you another thing, and this is gonna be really quick. I treat mostly women, and in all of our clinics, mostly we treat women. And I also don't look at it that way because what that means is that we just have to be more informed. And also because maybe the medical system is not educated enough in that way to treat people the same. I'm not sure what the root cause is. I have probably from 100% of the patients who have been recommended a hysterectomy due to either fibroids or endometriosis or a little cyst or whatever, probably less than 10% is other races other than women of color. And I don't know why. I'm really trying to
wow.
figure out this. I don't have, I think, if there is a womb that needs to be, and maybe there are factors, maybe women of color have more issues in their pelvic. I don't know. But that's a dramatic difference. I think in my whole history, I probably have met, I don't even know, like probably 10 women most who are not of color who have been offered hysterectomy. And I mean, I've treated a lot of patients.
Yeah,
So that is, I mean, I don't think that's probably like less than 1%.
yeah.
And I don't have anything, especially for women who have given birth, but there is a function of the uterus all the way until menopause and postmenopause. Because although the uterus does not secrete hormones, is the reason why we have a period. And when we don't have a period, then you, of course, where like, there is no cycle. So a lot of women start to have arthritis much earlier in life because they had a hysterectomy and accelerated the menopause. And that's not, I mean, my mother is a physician. And I was having this conversation with her because a family member was there and she had a hysterectomy. She has arthritis everywhere now at 62. And I'm like, well, at 40, they removed her womb because she had one fibroid and she had given birth to her three boys. And it's like, uterus are only there to have kids or have cancer. So just remove that. That's what her doctor told her. So she went into menopause very early. And therefore, because she wasn't having the period, my mother is like, no, the uterus doesn't secrete hormones. That should not affect her. I said, well, there is a function to the uterus to have hormonal health because you're not bleeding, you're not sharing the endometrium. And that sends a signal back to the ovaries. She preserved her ovaries. She still was having estrogen and progesterone, but there was something missing, and that was her period. So it's a long story, but the point is that is it definitely affects women of color to be just offer a hysterectomy, complete or partial, so frequently.
Yeah. It's a tricky conversation to have because there's no clear answer, right? You can't just I think a
Yes.
lot of it has to do with unconscious bias. It's not racism as, a thing that somebody wants to march out into the street and genocide people that don't look like them or anything like that.
No.
But it is certainly it seems to still be part of the substrate of like society or the zeitgeist or something like that. And I don't
Yeah.
know if just talking about it is enough to put people's attention on it so that, we can shift the tide. I don't know how far we have to go either. I think this applies both to women's health as a broad scope statement and
Yes.
to the subset of women of color that
Oh yeah.
um that the way that we should, it feels like, we have satellites in space where we get signals to our phone from anywhere and they can, you know, GPS our location. Like the advances in technology are so extreme that we're sending stuff to other planets now. And women still, we still can't regulate, hormones in a way that increases, quality of life. There's a disparity there. That's what it feels like. It feels like
Yes.
we put all our attention on the dude stuff, the the technologies
Yeah.
and the devices and the things. But when it comes to, our mothers and our other halves, we're not as
Yeah.
far as we should be. So I really appreciate, people like you, Rosanna, that have made this your life's mission and your purpose. Um, what would you say? Like, what's your answer to that? Is there something that people need to know or say or do or think about, or what does advocacy look like to you?
Advocacy, I believe it goes back to what we talk about, determining yourself. What are you going to accept or what normal is for you? And then be relentless until you get it. Because we all have the right to live a life fully. We change focus, we change wants, but it should not be at the expense of the things you want to do in life. You should not be home because you have so much pain 2 weeks out of the month, or having palpitations at night because you're in high alert constantly because of hormones, or gaining weight that you don't feel like you want to go out and put the clothes you love, or having mood swings affecting your relationship that you don't even know what the heck is happening. Like, what is happening? Why don't I feel like myself? And so determine first what normal is and go shoot for the stars, because you can have that. Most of us were born healthy. And even people with disabilities also were born healthy. Their organs work. There might be some stuff that we cannot do, but if somebody can lead a life, all their lives, and then now we're going through a phase, we don't change who we are just because there is a phase. We get relentless and figure out how we can continue to live a life that is acceptable and enjoyable to you. And then whoever doesn't contribute needs to go. That's basically the way I look at it.
Yeah.
Whoever doesn't contribute to that cause of you living a healthy life and being here, because I see we can be here and dying is very easy. But living a life full of vitality and health, that takes work. And so a lot of things come at us that are trying to take that away. And we have to be very relentless to say, like, no, that does not match, including practitioners who do not believe that you can do that, who tell you, and just because that's all they know, oh, this is as good as it gets. You just have to deal with that. It's aging, Now you are going down the hill, or it gets worse from here. Like, no, I have a patient who's 94. Her pulses are better than mine. And when I ask her, I'm like, how's your energy level? She's like, fantastic. I'm like, that's amazing. And then I ask her, how do you wake up in the morning? Because, a lot of people wake up in the morning. Now, wanting to wake up because they're tired. I, great. I go to the park with my dog. You know, that's amazing. That's what I want for all of our women when we bring in this message. Age
Yeah.
is going to happen. The phases are going to happen, but you can still thrive and feel amazing through those phases.
Yeah. Yeah. That aligns with kind of my own ideology about life and aging and all of that. I think that aging is, let's see, how can I say? It's like I call it a battle of attrition. So what I mean is that the older you get, the harder it is to get anywhere. Like you have to work harder than you had to when you were in your 20s. That's the main difference, is that when you're in your 20s, you could live whatever lifestyle you want to, partying and drugging and all the things,
Yeah.
and then take, you know, 6 months off of working out, and in 2 weeks you'll be back to where you were, right? When
Yes.
once you pass 40, and start entering into the second phase of life, it's like you get leaks in the inner tube of your tire, and you can keep it inflated, but you have to keep pumping. You can't, there's no
Yes.
days off. But provided you're doing that, the quality of life is like you said, what 50-year-olds look like now compared to when I was a kid in the 90s, it's night and day difference. We look at pictures of
Yes.
people that were on TV, in the 90s, and when you find out how old
Yes.
they are, you're like, how is this the same reality? Like it's so different. And I think if there's a silver lining to this, it's how much we are starting to understand. I would say that, the what we've learned about nutrition specifically in the last 5 years compared
Oh,
to the
yeah.
last 50 years before that, it's astronomically different. It's a completely different landscape. And we're talking about these therapies, and people are able to have long format conversations on podcasts now. And so
Yes.
the message is getting out there, in a way that kind of subverts the gatekeepers. There's a
Yes.
way to get the message out, and to me, that's good news. And that there's people like you in the world
Yes.
that are on the same mission. So thank you for what
Thank
you
you,
do,
David.
Dr. Rosanna. This has been a lovely conversation. If anybody
Yes.
wants to connect with you, what is the best way for them to do that?
So we are in 3 clinics. And so Women's Holistic Center is our newest location, and womensholistic.center.com, WashingtonHeightsWellness.com, and RiverdaleHolisticCenter.com. Whichever one of those sounds easiest to connect with, we offer a free consultation for our patients, and that's how we get started to see if we're the right fit. And it would be an honor, whether it's a practitioner or someone who heard this and feels like they want to be relentless on living a life full of joy and vitality. It would be an honor to be part of that journey.
I love it.
Thank
Impassioned
you.
living. Yes.
Yes, yes.
Thank you, Dr. Rosanna. We'll catch you guys on
Thank
the next
you.
one. Ciao.
Yes, care. Bye.